Botox is a great procedure. The beauty of Botox is it's both a preventative and a treatment. If you notice that you're starting to have either deeper wrinkles or even sometimes fine wrinkles around the forehead, around the eyes, or what we call the periorbital area, sometimes also along the middle of the nose, or what we call the 11s, the deep furrows that sometimes come from squinting. One of the ways I like to explain how Botox works is by a simple demonstration with a piece of cardboard. If you liken our skin to a piece of cardboard, when we're young and we're using our facial expressions, when we stop making those facial expressions, our skin looks great. Just like if you take a piece of cardboard and you bend it just a few times, it still looks like a nice piece of cardboard. As we age and we continue to make facial expressions, and wind and sun damage our skin, and we lose some of the collagen and some of the fat, the supporting structures of the skin, as we make these facial movements, the skin starts to break down, and that's what the crease is. What happens is Botox stops us from making those movements. Now, the beauty of our skin instead of cardboard is if you stop making those motions and the skin is calm, the skin will actually heal itself. It'll start to repair itself, and that fine line or that wrinkle will start to lessen. Botox works by reducing our expressions. We don't get rid of all expressions, but what we do is soften them, so we're not getting as much wear and tear on the skin. One of the benefits of Botox is you don't have to do it every 3 months to really see a benefit. Sometimes in certain patients, even if you do it twice a year, you're going to see great benefits. One of the reasons that you would consider getting Botox is if you're starting to notice fine lines and wrinkles, whether it's around your eyes, in the glabella, or in the brow, or sometimes even on the forehead. Botox generally lasts about 3 months. That's the basic rule of thumb. Now, does that mean you have to come in every 3 months to get the benefit of Botox? Absolutely not. Many of my patients come in twice a year. Remember, any time that you're not using those muscles of expression, or at least softening the muscles of expression, is a benefit to you. The reason to come to a facial plastic surgeon for your Botox is that we specialize in the face. We've spent our entire career learning about the muscles of the face, the expressions of the face, the movements of the face. And we use that knowledge to accurately place the Botox to soften the expressions but not freeze the face. This gives a very natural, soft appearance when you have Botox. There are no major risks to using Botox. The big risk that I tell patients is really bruising. Now, it is possible to have an allergic reaction, although I've never seen one. If you're going to come in for Botox, the things that I ask the patients to do is avoid aspirin products for about 3 days before you're coming in. Make sure that if you take fish oils or multivitamins that you limit those for the 3 days before you come in. And if you're bruising or you have any bleeding history, you tell your physician. If you follow those simple rules, generally you'll be able to get your Botox with minimal bruising and minimal risk.